Hey everybody, welcome back to the Hoffman Oncology channel. So today I'm at Dr. Hoffman's next door neighbor, office-wise.
That's right.
Dr. Rafiq. We're here in the Bronx at her clinic. She does integrative medicine. She's also a physician herself. She's got an incredible story, and she can tell us the problems with traditional medicine and how integrative medicine can help out. And first of all, thank you, Dr. Rafiq.
Oh, I appreciate it. It's a pleasure.
So
Yeah.
give us a little bit of background on yourself. I know there's a lot. We'll do more of these videos in the future, but just give us a little bit of background for anyone watching out there. Who are you? Why did you get into this? Because you started out as a traditional physician. So just let's get into that a little bit.
I discovered integrative medicine through really the course of treating my son, who was a young child with autism. And as a physician, I was grappling with the complexity of finding real tools and resources that would help him in guiding him through early days of having the speech delay, not being able to communicate his needs, also not being able to understand what foods and what diet would best serve him. And I found so many resources within the integrative community. And then from that, I really found that it was something that resonated with me and my mindset, where I was in the course of my career. I've 20 years have practiced really community-oriented primary care between being trained in Brooklyn and now in the Bronx since Montefiore. But I really found that our outlook in traditional medicine is very disease focused, and it really it treats the smoke, and not it really doesn't really take care of the fire, which is really the root cause. And so what I tend to explain it this way, because it's the best way to explain it to a patient, is that in medicine we're just constantly treating this fire because there's always an acute issue. People are coming in acutely ill. They have chronic diseases though, but we're not dealing with the root cause, why their metabolism has shifted, why they've created cardiometabolic dysfunction, which can lead to a lot of entities, including diabetes, heart disease, sometimes even autoimmune diseases, which are related to really good, proper gut health. So I went back to really kind of retooling and changing how I had different skills I needed to work with an integrative mindset, but I'm trying to bridge that gap that we have in society where we don't have the ability to really cater our primary care approach to that. A lot of our access in the East Coast is more in concierge practices. And I really felt that as someone who trained in very urban health, that majority of the inflammation and the fire is here in the Bronx and many urban areas. And it's a shame not to be able to really bridge that gap, because that's where the need is the greatest. So I kept really close to that intention. And myself personally, I have gone through the course of cancer, and really over the last 4 years have really dealt with breast cancer as a very early stage cancer, but found that in my heart that really brought me even closer to the experience of a patient. As a patient now, I'm looking for the same tools to say, well, if 1 in 3 women metastasize who are a survivor, how can I be the one that, the other 2 out of 3? I want to be the 2 out of 3.
Right.
And what are the tools that I can use? It's a shame though that the institutions and the atmosphere that we get treated in when we're acutely diagnosed with cancer are very eager to accept us as patients. However, when you're healthy and remission and you're a survivor, there isn't really a set of protocols or guidelines. It's kind of a loose relationship, and if you're very motivated, I think you look for those tools on your own. And it shouldn't be that way, I think, in healthcare. We have so many survivors of cancer across the board, and they've really looked for resources. And I see that they found it, and I found it personally, through a lot of naturopathic oncologists, who are, majority of them come really out of the West Coast, and their experience is very different. A lot of practices out there will have a health coach and a nutritionist with every primary care visit.
Personalized medicine.
We don't have the precision and personalized medicine that we really can really aspire to, and I think that that's what's missing.
I
is
think
the
we're
mindset.
heading in the
And
right
we're
direction.
heading there.
We're heading in the right direction. There's an e-patient movement online.
Yes.
Anyone that goes on Twitter or on Facebook, there's groups for
Yes.
e-patients, right? They call them empowered patients. And it's huge in the cancer community. Cancer survivors, people with going through cancer right now, they're sharing strategies. They're even sharing clinical trials. Like they're the most up to date on the latest happenings in medicine. So when it comes to integrative medicine, as we wrap up, what are some of the benefits for, because we'll tie this into oncology patients, what are some of the benefits for someone, let's say, that's diagnosed with cancer? Should they incorporate this in their lifestyle, even if they're currently going through chemo, or should this be something they do when they're in remission? What do you recommend?
I absolutely believe that it can be implemented while they're in care, post-care, and definitely as a lifestyle change. Because in general, cancer is like a wake-up call, and it's really to tell you that your body's out of balance. And then you have to determine through your own genomics, through your own personalized lifestyle plan, where are the defaults that your system was not able to really revive or eliminate cancer cells, because we all have an immune system that's hypervigilant, and every day we may be circulating out tumor cells. So our immune system has to be at its highest functioning. So where the lapses are, it really is a health plan for life. So I do believe that in good consultation with an oncologist and a breast surgeon or a surgical team, there can be methods of integrative care that are implemented during the course of even preparing for surgery, post-surgery, and then definitely in the scope of nutrition and lifestyle change. It's a huge aspect.
So there's a lot of synergies.
There is tremendous synergies, because in general, we find that now there's plenty of clinical trials that are looking at survivor benefits from low-carb diets, low ketogenic diet, low glycemic. So we know there's an avenue. Intermittent fasting, absolutely. And some of those aspects are what we want to incorporate.
Sure.
Vitamin D, curcumin, sulforaphane, so many other tools that can be used to enhance the wellness or the immune system function of a survivor.
And
so
are those some of the things you do here with your patients?
Definitely, I employ it not just in a patient who has cancer, but definitely with other patients that have other autoimmune or inflammatory conditions. Cancer is just like any other condition. If you look at it and break it down to its core components, it's how personalized you get to the patient and the individual, so that you're able to determine what would work best for them. And the biggest piece of it all, I believe, is not just the nutrition and the lifestyle changes, but the mental and mindfulness effects of using an integrative plan. Because for me, I'm very much a spiritually based and mindful practitioner. I feel a lot of our mindset is what really helps us overcome illness and to heal. So if we cannot engage our mind successfully as part of our driver in this goal, then it is really the biggest asset to ours, to integrative care. So meditation, mindfulness, a lot of guided approaches can be done along with yoga and cancer. There's a lot of great trials on that. The energy of your body and how the energy of the body has to be more grounded and in place, really resonate at its highest frequency. The cells of our body have to resonate. And that comes from not just resonating with good food, but good energy. So the energy of what we do, whether it's what we call forest bathing, right? Going out in nature, and all these things definitely improve the immune system.
Interesting.
So there are many other aspects of how our life has to change, because remember, I said cancer is just this red flag. It just says, look, you're out of balance. So find the areas of your life that you need to balance, and also change that, because if you're not doing that and you're doing all the other stuff, 1 out of 3 metastasize. So I think that's the key, is where have you not found the balance in your life?
Absolutely.
So, question from the audience, if I might.
Question from the audience, thank you.
So is there something, now you've already touched on this to a degree, Is there something that can be done like preemptively? Say lab results are abnormal. Is there anything that shows that you may be more inclined to develop cancer? And if so,
Excellent question.
can something be done preemptively?
Excellent. Actually, that is the key, I think, is now that focus. How do we help all the people that are now looking at how do I become healthier? They have family history. I personally had the same experience thinking, I have a family history of breast cancer. What can I do to prevent beyond the diagnostic radiology, which is often, the premise? So a lot of the other aspects of it, looking at genomics, looking at methylation, because how well we methylate, there are definitely genetic mutations that affect why an individual cannot repair their DNA properly. So if you're not doing those other testing, I think that will be a real helpful idea, because that's what personalized medicine is. I think beyond waiting till someone's sick, we definitely should be having this kind of focus and mindset for any health plan and wellness plan, which means before I become a diabetic, I should know how my insulin levels are. Am I churning out too much insulin? Should I have some ways of using herbs to maybe sensitize my own insulin? How do I reduce my carbs? How do I avoid the emotional eating that comes with a lot of craving as well? So it's that whole integrative approach is a more holistic approach.
But how does one, because I've gone through this, how does one convince their doctor, hey, I need these tests? And then he says, no, you don't. You're not sick. These are excessive. What do I do?
It is challenging, because I think the awakening and the mindset shift in paradigm shift in medicine is sometimes where it's kind of falling a little bit behind the consumer. And now being a patient myself, I find that I can go online and order Ubiome, so I can check my microbiome, and I don't even need to. You can actually go on Twitter, and I think they give you a discount. They're using a lot of the kits are available you can actually order straight out of your pocket, which is a bit of an investment, but the majority of these tests sometimes will require that. I think discussing first with someone who is your primary care physician and saying that you've looked at some of this research and bringing it forward may help, because it's just that they haven't been trained in this. It doesn't mean that they're going to be averse, and I think they're going to be open to it. It's just a whole new language, and it's a whole new set of tools. So not every doctor will be, but there are plenty of functional practitioners and functional medicine doctors, integrative doctors, and wellness doctors, and majority of our interests are looking at how we are eating, what kind of diet and lifestyle, which I think across the board isn't something that is a big cost prohibitive model. I mean, so many of the patients that I see are on their own doing like the Whole30 or doing some type of regimen where they're doing intermittent fasting or ketogenic diet to lose weight. What they're not realizing, it also helps them prevent other illnesses. So I think what I've done in my practice here is that sometimes what resonates with patients is that they'd rather lose weight. But the weight loss prevention is not the hook. It's kind of more of a let's look at your diet and do lifestyle changes and detoxify. So it's really under the guide of a weight loss program. It's an integrative program.
Fantastic.
So I think the key is starting with really the basics.
Yeah.
And if not, there are a lot of tools online. Definitely, that's what
Lot of
consumers are
tools,
seeking.
yeah.
Health seekers are seeking ways to find not just nutrition and lifestyle changes that they can maintain and aspire to that will provide them resilience and livelihood, but they also would like hormone balance, because a lot of hormone imbalance issues are creating a lot of disease and complications as well.
Absolutely. Integrative medicine, the rabbit hole really goes deep. I mean, you go online.
Yeah.
Where can people find you? How can they get a hold of you?
I am on Twitter at irafiq.com.
I have to follow you.
And Instagram, and I have a practice here in the Bronx. It's integrative medicine, but it's Nirvana Integrative Medicine. I felt practicing at the hospital was the opposite of Nirvana.
Yeah.
So when I encourage patients to come in, I'm hoping that
That was
I'm
the
able to
anti-Nirvana.
enlighten them, right, and enlighten myself. as to other ways of healing.
We'll have the links on the bottom of the video, and hopefully we'll do more.
Thank you.
Thank you very
Thanks
much.
so much.
And thank you everyone for watching.
Thank
Thank
you.
you, Chris Sauber, and take care.
Bye-bye.